COVID-19 is an infectious disease caused by a new coronavirus introduced for the first time. It is spread from person to person, mainly through the droplets produced when an infected person speaks, coughs, or sneezes. These droplets can land in the mouth or noses of people who are nearby. You have to know how it spreads. There is currently no vaccine to prevent coronavirus disease. The best way to prevent illness is to avoid being exposed to this virus. The virus is thought to spread mainly from person to person, between people who are in close contact with one another within about 6 feet, through respiratory droplets produced when an infected person coughs, sneezes, or talks. These droplets can land in the mouths or noses of people who are nearby or possibly be inhaled into the lungs. Some recent studies have suggested that COVID-19 may be spread by people who are not showing symptoms. There are certain mistakes which we make unknowingly or knowingly by touching our nose and mouth with infected hands. If we touch on some surfaces and we forgot to wash hands, then touching to your face and face surroundings, head, it's a big chance to get infected. By talking, standing, or sitting nearby another persons and avoiding the social distancing can increase the chance. Using same utensils, plates, sharing spoons and forks. Best way is to keep individual plates, spoons and forks for each person in the family or hostel or anywhere else. Avoid keeping the toothbrush or personal shaving sets and everything in the washroom, bathroom, or in the public places. So everyone should wash your hands often. Wash your hands often with soap and water for at least 20 seconds, especially after you have been in a public place or after blowing your nose, coughing, or sneezing. It's especially important to wash before eating or preparing food, before touching your face, after using the restroom, after leaving a public place, after blowing your nose, coughing, or sneezing, after handling your mask, after changing a diaper, after caring for someone sick, after touching animal or pets. If soap and water are not readily available, use a hand sanitizer that contains at least 60% of alcohol. Cover all surfaces of your hands and rub them together until they feel dry. Avoid touching mouth with unwashed hands. Avoid close contact inside your home. Avoid close contact with people who are sick. If possible, maintain 6 feet between the person who is sick and other household members. And outside your home, put 6 feet of distance between yourself and people who don't live in your household. Remember that some people without symptoms may be able to spread virus. Stay at least 6 feet from every person. Keeping distance from others is especially important for people who are at a higher risk of getting very sick. Cover your face. Cover your mask and nose with a mask when around others. You could spread COVID-19 to others even if you do not feel sick. Cover coughs and sneezes. Always cover your mouth and nose with a tissue when you cough or sneeze, or use the inside of your elbow, and do not spit. Clean and disinfect it everywhere around you, the surroundings. Monitor your health daily. Check your temperature daily.